Now, it's a delicate situation, an infant with a life-threatening heart condition, her family grappling with financial and emotional hardships after the heart surgeon meant to perform her life-saving surgery suddenly passes away. This is Liliana. The 3-month-old was diagnosed with a critical congenital heart defect before she was born.
As a mom, it has been so hard. I love my baby so much, and I just want her to be healthy.
Amanda says she was just 25 weeks pregnant when she found out Liliana has tetralogy of Fallot.
And my face goes white. I start having like a panic attack. I have no idea what's going on, but I know it's not good.
Tetralogy of Fallot is a combination of 4 defects affecting the heart and its blood vessels, impacting how oxygen is pumped through her little body. Holmes says it affects her circulation and her body temperature. If her blood pressure drops, she could turn blue and have to be rushed to the ER. She says the diagnosis
has just turned our whole world upside down.
They flew to Stanford to have Liliana and stayed there for 2 months, ensuring she was stable enough to come home. Holmes says they'd planned to have the surgery to repair Liliana's heart here at Kapi'olani Medical Center's Pediatric Heart Center. But they were surprised when their doctor told them they should return to the mainland for the procedure.
And they told us, you need to get to Stanford as soon as possible. There is not another option for you here. The only surgeon that could do the surgery just suddenly passed away.
Kapi'olani Medical Center confirms their pediatric cardiothoracic surgeon passed away in March, and they are in the process of recruiting a new specialist. They say they are still scheduling and performing heart surgeries, but they go on to say that even with their pediatric heart center, there are still complex surgeries that may require additional expertise and are done at Stanford Medicine Children's Health as part of their long-standing collaboration, along with other children's hospitals on the mainland based on the patient's and/or family's needs. Holmes says flying back to California is a hardship they weren't financially or emotionally prepared for.
And that's just scary and unexpected. So we've been really praying and trying to do the best that we can to stay positive, but it's been very, very difficult knowing that there's nothing we can do besides hope, pray, and get her to the best doctors possible.
Liliana's procedure is currently scheduled for April 24th, but Holmes says it could be moved up. They aren't sure exactly how long they'll have to stay in California, but anticipate a minimum of 6 weeks, given recovery time and follow-up care to ensure that Liliana is stable enough to fly home. And anyone interested in helping Liliana and her family can log on to KHON2.com for more information.